In this video, I will discuss infectious mononucleosis. Infectious mononucleosis is also known as kissing disease because it spreads through kissing, and also it is known as glandular fever because it is characterized by generalized lymphadenopathy. It is an acute self-limiting viral illness. It is caused by Epstein-Barr Virus, EBV. EBV is a cause of infectious mononucleosis, also Burkitt's lymphoma. So it is caused by Epstein-Barr virus. It is transmitted via saliva, so it is also known as kissing disease. It is common in adolescents and young adults. How it is transmitted? It is actually caused by Epstein-Barr virus, which is also known as human herpes virus 4, and it infects the B lymphocytes via CD21 receptor that is present on the surface of the B lymphocytes. It spreads through saliva as it is known as kissing disease, and rarely blood transfusions can lead to its transmission, but mainly it is spread through saliva, and when it spreads through saliva it infects the B lymphocytes inside the lymph nodes. Clinical features. There is a triad of features in case of infectious mononucleosis. First one is fever, second one is sore throat, and third one is generalized lymphadenopathy. Due to this sore throat, mostly people think that it is Streptococcus pyogenes and give amoxicillin. This amoxicillin leads to development of generalized maculopapular rash. So this amoxicillin is when given, it leads to generalized maculopapular rash. It is also diagnostic for this infectious mononucleosis. So there is a triad of fever, sore throat and generalized lymphadenopathy, especially posterior cervical lymph nodes. There is marked fatigue as we've seen in other infections too, and malaise. Tonsillar exudates can be seen on examination, and palatal petechia can be seen on examination of the oral cavity. Oral cavity is when examined, it shows palatal petechia. So there is a triad of fever, sore throat and generalized lymphadenopathy. There is fatigue and malaise that may be seen with any other infection too, but there are tonsillar exudates and palatal petechia. This is very important. The patients who have infectious nucleosis have palatal petechia. There is marked splenomegaly, and this splenomegaly has a risk of rupture with contact sports. So you should avoid contact sports if you have splenomegaly and infectious mononucleosis. There may be hepatomegaly. Rash is seen if given ampicillin or amoxicillin, as I have told you. Laboratory findings. When you perform CBC shows lymphocytosis, and on peripheral smear there is more than 10% atypical lymphocytes, downy cells. CBC shows lymphocytosis and peripheral smear shows atypical lymphocytosis. This is positive monospot test seen in infectious mononucleosis, also known as heterophile antibody test, and it is diagnostic for infectious mononucleosis. There is mild derangement of the LFTs, but the laboratory findings that are important are on CBC lymphocytosis, on peripheral smear atypical lymphocytes, and diagnostic test is positive monospot or heterophile antibody test. Complications. Splenic rupture, so avoid contact sports if you have infectious mononucleosis. Furthermore, autoimmune hemolytic anemia, especially IgM mediated, called autoimmune hemolytic anemia, and thrombocytopenia, and rare complications are airway obstruction due to lymphadenopathy, and some other neurologic complications can be seen. Of these, the most important is splenic rupture. Management. Supportive treatment is just required because it is a self-limiting viral infection. So supportive treatment includes rest, hydration and analgesics for pain and fever. Avoid contact sports for 3 to 4 weeks. Some people say for 8 weeks. Steroids can only be given for severe airway obstruction or hemolytic anemia, and no antibiotics are needed because it is a viral infection, and if there is concomitant bacterial co-infection, then you should go for antibiotics, otherwise not required. Prognosis: it is a self-limiting viral infection and it recovers in 2 to 4 weeks. Latent EBV persists lifelong. So this is all about infectious mononucleosis.